Barbara, my lovely wife, often reminds me how relieved I was in 1986 when, after 17 years, I ended my career as a surgeon to become a full-time epidemiologist. I was relieved because my mission now was to search the truth rather than to guess as a practicing doctor. During the ensuing 27 years, my professional career has been continuously rewarding. Still, the real culmination was the 5 years during which I served as chair of the epidemiology department with its amazing faculty, staff, and students. I cannot imagine a greater professional privilege.
I came to Harvard for 1 year, almost 30 years ago. And the reason I'm still here is that I fell in love with epidemiology. The idea that we had methods to ascertain the causes of disease, and if we understood the causes, then we had the foundational knowledge to prevent disease. Of all the public health disciplines, epidemiology has the broadest canvas in terms of geography, methods, and applications. And so here I am, almost 30 years later, still excited to be an epidemiologist.
Hi, I'm Joanne Manson, professor in the Department of Epidemiology and chief of the Division of Preventive Medicine at Brigham and Women's Hospital. It would be difficult to imagine a field that has contributed more to improvement of population health over the past 2 centuries than the field of epidemiology. It's also difficult to imagine a field that could be more gratifying in terms of opportunities to advance knowledge and to make a difference in people's lives. For example, analyses from the Nurses' Health Study and other epidemiologic cohorts have suggested that based on available knowledge about risk factors, about 80% of heart disease and strokes, 90% of type 2 diabetes, and about 50% of cancers could be prevented. These are the leading killers in the United States and throughout the world. But so much more still needs to be done in implementing this knowledge and reducing health disparities. Coming to epidemiology from clinical medicine, internal medicine, and endocrinology, I've come to see how epidemiologic research really informs clinical practice as well. Although nothing can replace the one-on-one relationship you develop with patients as a physician, it's been a true privilege to be able to be involved in epidemiologic research that can have a reach far beyond a single clinical practice. I've been very grateful for the opportunities and wonderful collaborations that the Harvard School of Public Health has provided for me and for my colleagues. Thank you and best wishes to all.
We love Epi.
Yay!
We want. I chose to study epidemiology because I really like health and science and statistics, but I really don't like other people's blood and germs.
I thought I was going to be a skin doctor.
My first day of work at HSPH was Thursday, October 1, 2009, and that Saturday I went to the prospective student open house, knowing virtually nothing about the epidemiology department, but there to answer any questions that I possibly could. And Alec Walker was happened to be the faculty member that day at the epidemiology table, and we talked for a little bit, and he said something to me that I've always remembered and always comes through in the culture of HSPH. He said that one great thing about this place is that all the faculty and students here, their goal is to make the world a better place. And every day I come to work I think about that, and it makes me happy and excited to be a part of this place.
Happy 100th anniversary, HSPH. We're the GREAT team, and we're going to share with you why we chose to study epidemiology.
Hi, it's a pleasure to be here and celebrate with you. So I always wanted to help people, and epidemiology has offered me the opportunity to do that in a multiplicative scale, in a globalized world. So imagine that you are in an isolated region area in Africa. If you have you treat children with antibiotics because there is a diarrhea problem or infectious disease, you will solve an individual problem, obviously important. But however, if you provide access to clean water and sanitation to the entire community, probably you will solve the problem in a multiplicative way. So helping the entire community to reduce the number of children with diarrhea. Isn't it terrific? It's for that reason that I love epidemiology.
And I like epidemiology because it's like a giant puzzle that you're trying to solve, so you work at it piece by piece until you are able to come to conclusions and hopefully solve the puzzle.
The first time I want to be an epidemiologist is during the outbreak of SARS in 2003. Epidemiologists are heroes.
I became an epidemiologist actually by a random error. Why? Because when I was a middle school student, my dream was to become a nice physician, to help ill people. When I applied for medical school, I was assigned to preventive medicine instead of medicine field. Now I'm happy to be an epidemiologist because I think it's a more efficient way to save more people at one time.
The reason why I chose this EPIC area of study because it was a way to help millions of people while combining my passions in biology, mathematics, and philosophy.
I chose epidemiology because it provided me the toolkit to solve some of the major public health problems in global settings. I love epidemiology because it goes beyond the science. It's the applied field of public health. It's the engineering of public health. That's why I love epidemiology.
Well, here we have Dr. Ralph Patenberger, who's made it to the finish line. Dr. Patenberger is an epidemiologist at Stanford University and also a visiting professor at our department. And he's not only a master marathoner, but his research interest is actually in the effect of exercise on health. Well, Dr. Patenberger, I've selected you as a control for my case control study. I gather that you have no injuries. Did you suffer any injury or delirium or nausea as you came into the finish line?
I'm tired, I'm left-handed, but otherwise I'm fine.
You're fine?
Yeah.
So Lorelei and I have really grown up in the epi department together. When I first met her, she was just finishing up being a student here in the department. And now I'm her program manager. She's an associate professor, and we're doing really exciting work in prostate cancer research. So Lorelei, could you tell me a favorite memory you have in the epi department?
Sure. So one of my favorite memories is the time that I spent with a professor here named Jonathan Freeman, who was an infectious disease epidemiologist and a wonderful mentor and teacher. And I was his TA for 2 years. And he really impacted me so wonderfully as a student. And I just remember his kindness and warmth and enthusiasm about teaching. Mm. How about for you, David? What's a favorite memory?
Well, one thing that kind of came full circle for me, when I first started, I was the assistant to the chair working for Mayor Stamfer. And a lot of times he would have me do work for Brian McMahon, who was the first chair of the department. And Brian was working hard on his research right until he passed away. So he would have me go to the Countway Library to get articles for him. And it was exciting to be attached to the past in that way. And then when he passed away, we did a Cutter lecture that was a tribute to him, and I helped plan that event. And it was really great hearing from all these professors from around the world who had been affected by him and inspired by him. And it made me even more inspired and feel lucky to have gotten to work with such a towering figure in epidemiology.
Yeah, this department has had such amazing people. I remember being a student of Dimitris Trikopoulos's and the time we would spend together, he would have people come from all over the world, and we'd be sitting in his office, sharing ideas, throwing around new novel hypotheses, writing papers together in a day. It was just an exciting place to be.
Yeah, and one thing I love about this department is it's not just about the science, it's about the people, and bringing people together to create really exciting science.
Yeah, I've learned a lot from a lot of different people, but I did want to say how much I've learned from you, David. You've taught me a lot about collaboration, about being a generous person, and I've loved knowing you these past 8 years.
Well, now I'm not just saying this, but I've learned a lot from you as well, in terms of following through with things, thinking creatively, and you've inspired me to now probably leave the department and do other exciting things. No, I'm just kidding. But I love my time here as well.
Me too.
Thank you, Lorelei.
Thank you.
Back in the early 80s, when I was still a student, I had the opportunity to attend a conference on smoking and health in London, and among the participants were Brian McMahon and Sir Richard Dahl. As a student at Harvard, I thought I knew a lot, and I offered the opinion that, of course, self-report of age at quitting smoking would have a lot of face validity because everybody would remember such a momentous event. And at that point, Brian McMahon turned to Sir Richard Dahl and said, "Well, Richard, do you remember when you quit smoking? I don't remember when I quit smoking." That was my leading memory of the two luminaries in epidemiology.